The Cleveland Department of Public Health received more than $5 million from maternal health care. Some of this money will go towards their Moms First program. News 5's Maya Lockett spoke with program leaders about their efforts in helping moms.
People say it takes a village. A lot of people don't have a village to help them.
Kayla Hayensworth is the mother of 19-month-old Nova.
She is starting to learn new activities and stuff like that, going to daycare.
When Nova was an infant, she was a member of the Cleveland Department of Public Health Moms First program.
Moms First is just like that backbone of support that you need, that you're expecting to have within a family, but it's within a community.
It is a home visiting program providing outreach, case management, care coordination, and health education for expecting mothers and their families.
When I had some struggles or some concerns about what my kid was and wasn't doing, like teething and stuff like that, and feeding schedule switching up and stuff like that. So my home visitor, she gave me some tips that I could use.
But the support did not stop there.
There were times where I was short on cash and I didn't have money for wipes, so she was hands deck on wipes. I could call her any time of the day if she was available.
In 2023, the program helped 677 families and mothers thrive through the first 18 months of their babies' lives. And now their primary goal is to reduce the number of African American families who experience the death of a newborn before the first birthday.
The community health workers really provide this relationship voice and advocacy for some of the families that I don't think would be there for them.
According to CDPH, 5.7% of Ohio births were deemed to have inadequate prenatal care during a 5-year span, which is higher than the national rate of 14.5%. In their efforts to address maternal mortality and maternal health disparities, in Cleveland, the program received an annual Healthy Start Award of $1 million from the Health Resources and Services Administration.
We're not seeing the same improvements overall as we are on a nationwide basis, is really telling.
Lita Wills is the Commissioner of Health Equity and Social Justice at CDPH. She says the racial disparities are far beyond health care.
Looking at things like our housing situations, looking at things like our economic situations, our level of education, our access to information. And so we know we have a history in this city of trying to make sure that everyone gets equal opportunities and equal treatment, but we know that additional services are needed to address those underlying causes.
Maya Lockett, News 5.